So, in this video, we are going to be talking about the assessment and management of facial pain. Whenever you're going to assess a patient for facial pain and you're going to manage a patient for facial pain, there's going to be two things, right? Actually three things. Assessment में हमारे पास दो चीज़ें आ जाती हैं, that is your history and examination, and lastly management करेंगे हम उस patient की पेन कंडीशन को रिलीव करेंगे, राइट. सो हिस्ट्री के अंदर इन दिस केस व्हाट विल बी इंक्लूडेड इन हिस्ट्री. So history of a patient obviously is including the basic introduction and demographic details of the patient, and then we go on with presenting complaint. In this case our presenting complaint is pain, after which we move on to history of presenting complaint. So pain ki history of presenting complaint, you can either go for Socrates mnemonic, which is site, onset, character, radiation, associated factors, time, exacerbating factors, and severity, or you can go for individual things that is written in your book, that is the location of pain, duration of pain, radiation, periodicity, onset, frequency of pain, intensity of pain, character of pain, right? And then we have modifying factors, which is basically initiating factors, aggravating factors, and alleviating factors. Then we have the effect of the pain on lifestyle. How has the pain kind of affected the patient's lifestyle? And then we have effect of pain on the mood of the patient, whether it has caused any sort of a depression or anxiety in the patient. And then we move on to outcomes of previous investigations or therapies. अगर patient ने कोई previous investigation करवाई है या previously he has been on some sort of a medication, तो उसका क्या effect हुआ है patient के ऊपर, whether it has caused relief of that pain or it has aggravated the pain. And then we can use visual analog scale, linear pain scale, or the McGill questionnaire. For pain, we can move on to dental history, medical history, which includes your drug history, alcohol history, and lastly social history aa jati hai. So this is all for the history that you're going to be asking the patient. Important thing is the presenting complaint. You move on to history of presenting complaint. You include the modifying factors, and then you talk about outcomes of previous investigations, effect on mood of the patient, effect on lifestyle, and then we use visual analog scales as well, dental history, medical history, and social history. Then we have examination. Examination is something that needs to be done. The mnemonic for examination is ORC IDR. It's kind of a weird one, but it is important because it's going to be easy for you to remember. ORCIDR. O say we have odontogenic structures. Odontogenic structures basically include your teeth, dental status. You can go with pulp vitality test or occlusal relationship, whether it is a static or dynamic occlusal relationship. So that is odontogenic structures. You're going to examine the odontogenic structures. Then you're going to examine R is going to be your related structures. To be associated related structures and the muscles of mastication, the sinuses, the salivary glands, and the temporomandibular joint. And then C say most important, cranial nerve function test. Cranial nerve functions need to be assessed. Gross, sensory, and motor deficits need to be identified. What can be gross, sensory, and motor deficits? Obviously, proper evaluation of cranial nerve 5 and cranial nerve 7. Sensory है तो patient के anesthesia, dysesthesia, paresthesias, hyperalgesias हो सकते हैं. और अगर motor deficits हैं तो there's going to be muscle paralysis, there's going to be muscle atrophy, there's going to be spasticity of the muscles. उसके बाद वी हैव आई से आ जाती हैं सारी की सारी इन्वेस्टिगेशंस जो भी आप करवाएंगे. इस केस में वी कैन गो फॉर रेडिएशंस, वी कैन गो फॉर इमेजिंग, वी कैन गो फॉर बायोप्सीज, हीमेटोलॉजिकल टेस्ट, B12 लेवल्स आइडेंटिफाई कर सकते हैं. वी कैन गो फॉर ESR, CRP, कोई एसोसिएटेड इन्फ्लेमेशन तो नहीं है. डायनामिक ऑक्लूजल अप्लायंसी कर सकते हैं ऑक्लूजल रिलेशनशिप को चेक करने के लिए. साइकोजेनिक क्वेश्चनर्स, वायरोलॉजी टेस्टिंग कर सकते हैं. नर्व कंडक्शन टेस्ट परफॉर्म कर सकते हैं. सो ऑल ऑफ दीज टेस्ट आर इंक्लूडेड. एंड डी से इज़ वेरी वेरी इंपॉर्टेंट, दैट इज़ द मोस्ट इंपॉर्टेंट डायग्नोस्टिक टेस्ट. That is your local anesthetic nerve block test, which is used to identify or confirm referred pain. And lastly, is request further information from the dental practitioner or specialist. Lastly हमारे पास आ जाता है management. How will you manage the patient? You're going to first of all establish the patient's likely adherence to treatment and his treatment goals as well. You're going to then eliminate, so you're going to remember this as EE, eliminate odontogenic pain, right? So you can dress a restored tooth, you can carry out occlusal adjustment, extraction. Then you move on to medical treatment. That can be either carbamazepine or antidepressant depending upon the condition, neuropathic pain here. And then you lastly refer the patient. So this is very easy management. क्या है? EEMR है. That is going to be establish the patient's likely adherence to treatment and treatment goals, eliminate odontogenic pain, medications, carbamazepine, antidepressants, and refer to a neurologist or specialist for nerve conduction test. So this was all for assessment and management of facial pain. This can come as an SEQ, or it can be a part of your OSCE as well. So it is important that you provide a detailed history, examination, and management.